our behavioral health efforts in the school setting. And so I am really pleased that you guys are volunteering or helping us out to spread the word about Kognito as a free resource to those that work in schools within your areas, to just kind of help the behavioral health efforts of our students overall. So I will kind of go through my PowerPoint, and I probably will have issues because I can never get sound to play. So we'll work through that. And then I just kind of wanted to share a little bit about some other resources aside from Kognito that we kind of have going on with the division, just so you're aware as you're talking to some of the schools within your region. And then I'll show you the website where, if you want to kind of pass this along to your community, about where they can find some of these resources. And so hopefully I won't even take the whole hour of your time, especially right before lunch. And feel free to kind of drop a question in the chat, save them for the end, whatever you want to do. And I will do my best to kind of watch that. So with that, we will get started with Kognito. And so Kognito, I believe, this is only my 5th month in this position, but I think that Kognito has been around since 2021, and we are currently under contract until June of 2024. So we have just a little over a year left on this contract to provide this to people that are in the schools. Hoping to continue that on just because we feel like the work is so valuable, and the training is definitely unique. And so as we kind of go through that, I'll share a little bit about how Kognito is a little bit more unique than some of our other professional development opportunities. And so Kognito is a simulation. And so users, could be your teachers, your admin, your paraprofessionals, they're able to actually interact with a virtual student. And, as I've gone through these myself and being a former teacher who taught special education for 11 years, the students within the simulation are very realistic. I kind of felt like I had a few students that were just like them as I was going through this. And so as you're kind of interacting with this virtual student, you're kind of working through some different scenarios that are very applicable to our youth today, things that they're going through. And as you're going through and you're kind of navigating this and you're, kind of in the talk feature, you're figuring out what should I say to this student, there's actually kind of a virtual coach that's telling you, yep, you're on the right track. No, this is really harmful. And then you can actually undo that and then try a different talking point or dialogue option. And so a lot of times when I'm talking through this with staff, I'll say, pick what you would truly say and just see if that's the right way to say it or if it's kind of a conversation closer. And so as I went through them, there were times that I probably did not say the right thing. And so I would actually pick that to just kind of see like, what did that do and how could that have hindered our relationship? And then afterward, you kind of get that personalized performance summary that helps you know what to do next time. And so I'm going to try to see if this will work with the sound. So Callie, maybe if you can let me know if the sound is working on your end.
Today's
I
school
do
leaders
not. Oh,
increasingly
yep, we're
recognize
good.
the connection between student mental health and academic performance, attendance, and safety. The challenge is how to engage educators as effective eyes and ears of student mental health. Cognito's At Risk for PK-12 Educators is a suite of online, evidence-based professional development programs. These unique interactive role-play simulations build the skills and self-confidence of school personnel to recognize students in distress, talk with them, and if needed, make a warm handoff to support. In the at-risk interactive experience, Educators meet their virtual coach and learn what to do when they're concerned about a student, how to bring up their concern, increase connectedness, build resilience, and link students to support. Through a series of interactive scenarios, they practice leading conversations with virtual students who show signs of anxiety, depression, substance use, and thoughts of suicide. The students react like actual students. Meanwhile, the virtual coach provides real-time performance feedback. With hundreds of thousands of teachers trained to date, Kognito's At Risk is the program of choice for schools, districts, and state agencies seeking to rapidly and cost-effectively build capacity and drive change in their schools. In addition to a state-of-the-art learning experience, Kognito simulations are easy to implement. They include hosting and technical support, usage tracking, surveys, and program customization. We can also help with district or statewide rollout. To learn more, contact us or visit our website.
So that was kind of their selling video to us, but it at least kind of gives you an idea of what it looks like. And the at-risk modules are what we do have available to teachers within North Dakota. I apologize. I didn't know if I touched my slideshow that it would take off the video, so apologies. So Cognito offers a safe, non-confrontational practice environment, allows for more engagement, and is really realistic. And what we've heard from teachers and school staff is, we've done the professional development, we know what we should say, we know what we shouldn't say, in kind of a way, but really like they've never been able to practice it. So, most of our teachers know what trauma informed means. They know what motivational interviewing means. And what they've kind of said is now we want to know, how do we do it? How do we practice it? And so that's what Cognito kind of allows them to do, is to take all of that learning that I know is going on in schools through professional development as it relates to mental health, but then actually kind of giving the practice without so to speak, screwing up on a kid and saying something wrong to them. And so just kind of that little bit takes about an hour to do, but that can really help with some sustained behavior change in our youth and in our staff. And so the learning objectives as they relate to Cognito is, we really want staff to learn to recognize those warning signs. They walk through them, how to initiate this conversation that can be very difficult at times, how to connect them to the appropriate services, because, often we hear from teachers we're not mental health experts. And so, how do we get them to the right place? And then learn those motivational interviewing techniques that's going to be a conversation enhancer and not necessarily a conversation stop. So that's kind of what we look for in those modules and hope that teachers feel capable of doing once they've completed the training. And so what we have available is we have kind of 3 suites, so to speak. Like I said, each suite takes about an hour. And so we have it for at risk for high school, at risk for middle school, and at risk for elementary. And, I know that some of you maybe cover some more rural areas where you have a K through 12 school, and you might have a special ed teacher doing K through 8 or 6 through 12. And teachers can sign up to do more than one. And so if you have a teacher that does middle school and high school, they can go through the middle school and high school modules. It doesn't say that you can only pick one. You could do all three. If you're maybe the counselor in a K through 12 school that um, interacts with a variety of ages. And this slide just kind of shows who is that virtual student or parent and what their struggles are within those modules. And so I've done the high school and I've done the elementary. Like I said, they're very realistic. I have not done the middle school one yet myself, but really looking forward to getting some time to go into that. But we do have anxiety, we have, thoughts of suicide, possible self-harm. Those are all addressed kind of in some of these different students or in the elementary level, that teacher. And this one we get a lot of feedback on as it being helpful because this is an elementary teacher having to talk to a parent about a student who is maybe having issues in their classroom. And so they really appreciate that perspective and kind of having that simulation as to how to interact with that parent and not come across as maybe something that's going to damage that relationship. And so Kognito is available to really anybody who works within a school setting, anybody who works with kids. And so our typical users are usually the counselors, the teachers, a few principals, but really anybody. Your bus driver could do this if maybe they're concerned about students on the bus. Your after school staff can also do this. We really hope that anybody who encounters a student in their day would be willing to take a little bit of time and kind of go through this training. Even custodians, when I taught, it seemed our custodians had some of the best relationships with kids. Could they be of value in helping them through maybe a mental health, not crisis, but issue? So just a little bit, we did add student teachers. And so if there are student teachers within the building or field experience, they can also have access to this program, as well as all of our special education units. We know that within the special education units, there's not always staff that go into a specific school, but they rather work for the unit. And we wanted to make sure that they are also able to access. And so to actually go through and get into Kognito, and I'll show you where this is on our website as well. But you're going to go to our website, you're going to use your school email, you're going to create a password, and then you're going to be set to go. And anytime, I know that things come up and teachers, might be 10 minutes in and then they have to go and maybe grab their class from specials. It saves their work in real time so they never have to worry about where was I? Am I going to have to go into the beginning? They can just kind of work with it as they have time. And again, I'll show you where they can find this on our website. And this is just a little bit something that we get from Kognito from time to time is called our heat map. And so what this does is it shows any county with an activation of somebody who has signed up for Kognito. And so right now, I think with the math was about 34 counties are using Kognito, at least with one person. And so our hope is to see every county on this map turn blue. And like, again, that's only one person who is activated within that county. Obviously, we hope there are many more. And when we had pulled this in December, we had 813 activations. Right now, I think we're up to 966. I know some schools were using it for professional development on Martin Luther King Jr. Day when kids were out. And so we saw a big increase there. Um, we are finding it is not utilized as much as we would hope. And so that's where we're hoping that maybe you can help us spread the word and get this number up even more. I think right now with teachers, um, any kind of teacher and paraprofessional staff, we're at about a 5% utilization rate in the state, and we would like to see that increase. And as you can kind of see, most people, once you finish the modules, they kind of give you a little exit survey. And so this is the stuff that we've gotten from that survey. And I think one of the most important things is just that 98% of the people who have taken it would recommend it. And that's kind of what we look for. We don't want to make this, we don't want to continue something that people don't find valuable. And so far we have found that it is very valuable to those who have done it.
Kayla, Chris Peel asked in the chat, is there a way to find out which schools are using it? And that as a
Yes.
public health unit, they can reach out and see how they can help.
Yes, I'll show you. That is a new feature to our website. And actually, after this meeting, I will be updating that list with some of our 150 people who have added. So I will show you where to find that. And then here's just my contact information. And so if you have any questions as you're kind of working through this with some of the schools within your area, feel free to reach out. If you would like me to come and present to maybe some of your community members, some of your schools, just let me know. It can be as brief as just as this PowerPoint. It can just be an overview of the website, whatever would be valuable. So um, take that down. Please contact me. I'm happy to help in any way. And then that's just our new updated website. I'm sure you maybe have gone to it, but I'll show you how to find our education initiatives within there. And so that is the end of my actual spiel. But does anybody have any questions as they relate to Kognito before I kind of go to the website piece? Perfect. That must mean I do something right today. All right, so I'm going to start sharing here from our website and just kind of show you a few of the things that we have going on. So as you get to that hhs.nd.gov, we are under our service areas for behavioral health, and it's a few clicks to get to our section, so I apologize for that. So you're going to go into our mental health section and go down to behavioral health and education integration. It's still so slow. All right, so Kognito is right up here at the top. And so just kind of talks a little bit about it, but to actually access it, you're going to click on this link and it's going to take you to the Kognito portal, and you're going to be able to find your school. We should have every single school in here. I know that sometimes we get questions about like co-ops. I know some of the like CTE programs are a multitude of schools that they're teaching. Just pick one, and it just kind of assigns you to that school, but there's nothing that would change how it would work. So they can choose. We do have private schools in here. And like I said, we have our special education units. So there's a variety of different ways. They're just going to find their school and they're going to put in their email and then they're going to be good to go. So you had asked who is using this. And so we are working at least monthly to update this so that people have an idea of who is using it. I've tried to organize it by county as best that I was able. And like I said, my goal is to have this updated in within the next couple days to get it to our person who does our website edits. So once a month you can pop on, see if there's any schools that are using it. If there's schools that aren't using it, that might help direct you a little bit. And then just that progress report that I showed you, we'll just kind of put whatever one is most recently given to us. So you are able to kind of see county-wise. I like that map. So any questions on the Kognito piece before I move on? Perfect. So we have a couple other initiatives going on within behavioral health in the schools. We have our behavioral health school grant funding, which I think some of the schools that are in your areas are utilizing. This is all based on Medicaid reimbursement from the previous year. That is how a school or a district or a unit is eligible. So I won't really go into that one, but one thing I wanted to make you aware of is that legislative session, I can't remember if it was 2 years ago now or 4, they passed a law that said every school must identify a behavioral health resource coordinator. And so we've gotten that list. They have to report it to DPI, but this person within the school is receiving resources on a weekly basis from our partners at Be Hero. And so what we're finding is those opportunities and those resources are not always getting to the teachers within the school. So that's just kind of why I wanted to make you aware that this person does exist, and they have access to other resources that might benefit the behavioral health of students within your school. Um, so just wanted to make you aware they exist. Our hope is that they maybe are utilized more as maybe a guiding factor within the schools, bringing up those opportunities. And then they have also put all their stuff together into a website. And what Be Hero does is they provide those resources, but one other thing that they can also provide is professional development and implementation support. And so if you have some schools that are maybe thinking about that we need some suicide prevention and intervention, have their behavioral health resource coordinator reach out to Be Hero because they could do some question, persuade, refer training, which is a new suicide prevention intervention type of training. They can do some sources of strength implementation, crisis prepare, different things like that. And so as you're talking with schools and they're still looking for more resources, this would be a good place to go.
Kayla, we have another question in the chat. Chris
Yeah.
Peel asked, when you register to look at it from the local public health units, what school do you use to register, or do you register under all? Do we have the ability for like them to register and look at it, or is it just the schools?
It is just the schools because I believe they have to have that .edu or some kind of variation of it in that email to get it to work. Like I couldn't use my personal Gmail to log on to Kognito. And so at this point in time, it's just for the schools, but I have my login up so you can kind of see what it looks like when they get into it. And so when they get in, like I said, they get to choose between the three. They can do more than one. They're gonna launch it. Oh, make it log back in again. It's been too long. And so what it's gonna have them do is do a pre-survey. And then it's gonna take them through the actual course. And this is just kind of what it looks like. Last time we weren't able to get any sound to work, and I'm kind of wondering if that's maybe something that's embedded in the Kognito website that they maybe don't want that all shared, but I can at least show you what it looks like. So you're just kind of going to play through it. It gives you a little bit of an introduction, and then it actually goes right into the scenarios. And within each activity, it kind of gives you some tips and tricks before you start the simulation. And so that's really helpful. It gives you kind of that, like, this is what you should do, this is what you shouldn't do before you ever start. And then there's always kind of a few minutes of a conclusion. And at the end, like I said, we have that post survey just asking if people found value. But then also within, once they complete it, they get a certificate of completion. And I know some schools are keeping this because Century Code does require certain amounts of mental health professional development. And so they can print that certificate and that can count as one of the hours that they need. And then it also gives them some additional resources. And the way that Kognito was set up is it could be as simple as just having each teacher go through it for themselves. There's also extension activities that could be used within maybe professional learning community or a team time, different things like that. So they do give quite a bit of additional information for people to review. And I know one thing I do highlight, and they haven't changed it yet, but the suicide prevention lifeline they still have as the full number, not 988, but I'm working with them, kind of hounding them until they do that. So just kind of a little overview of what they see when they're in there. Each grade section has resources, follow-up extension activities, and those behavioral health resource coordinators that I told you about can connect with Be Hero, and Be Hero also has extension activities for professional development, and they're willing to help with some implementation setup, some guidance, different things like that. So they're a great resource as well. So I'm going to stop sharing so I can see, are there any questions as it relates to anything?
There's been a little bit in the chat.
Okay.
Kind of, I know that I think Kayla and you talked about like trying to get the local public health units access and seeing if there's any potential to opening up that access to them. I think Cassandra made a good point that they go into the schools to kind of teach too at times. So like it would be beneficial for them to be able to do the modules themselves. I don't know if there's any workaround for that or if it's just the fact that you have to register with an EDU email. I'm not sure what a workaround would be or if there's something that we could do to make that happen, but that's a point that was made.
Yeah, so we would have to work with Kognito to see if that would fall under their platform. Otherwise, they could end up maybe charging us more, different things like that. So that would be a question that I could pose to our partners over at Kognito to see if that's a possibility. Um, and again, I just don't know with that email piece, because I know like when I signed up Callie and Tom so they could kind of have an idea of what they were reimbursing for, I had to go through and submit their emails to get them access. So yeah, the nurses would have access. And so if you have them, they would be able to gain access to that as well. Um, I did see something about parents. And so Cognito has a whole library of modules. We have only purchased the at-risk for elementary, middle, and high school. Um, they they do have the parent modules though. We've worked through them and they are really good. It's just not something that we can provide at this time. But we do have Parents Lead, and I'm hoping most of you probably are familiar with that. But that would be a good resource for the parent piece at this time. Hopefully we can offer more of the modules as we get going here. But that's really where we want to increase our utilization and just show how much of a benefit this is. See if there's any.
I don't know if Parents Lead has anything like module related like this. I don't know, Tom, but you're a little more familiar with it than I am, but I
Nope.
don't know if they have anything similar, but if that would be something that we hopefully could try and make happen.
Yeah, we don't have anything similar for Parents Lead when it comes to a module like how to talk to your kids about substance use or misuse or anything like that. But that would be a great idea if someone did have one. Does Cognito have a module like that
They do
that you
have
know of?
parent modules that we had looked at, but the funding wasn't there.
Right, it's pretty spendy.
Yep. We're hoping to have some other opportunities that come out in the next month or two. And so once those do, I'll make sure to let Callie and Tom know so that they can pass that along to you. We're pretty excited about it. We just can't say anything quite yet.
Do you provide us an update, Kayla, when you get the website updated with the most current schools? Because then Callie and I could send it out to the public health units when it's updated so that they can
Yep.
take a look and see where they're at.
I can send it to you along with Amy. I know sometimes it takes Amy a few days since she's doing the one pagers. So I can just send that list to you guys right away. So then you don't even have to wait for it to be on the website. And then
Perfect.
moving forward, it'll just be updated once a month. So I can't even tell you for sure by a certain date. Right now, Cognito's reporting functionality is not working all the time. So it kind of is at the mercy of their website currently. So, but I am hoping, Tom, to get that done actually right after this meeting and get that finished. So hopefully by the end of the day, I'll get that to you guys.
That would be
And you
great
can
because then we'll send
see,
the recording of this presentation, which was great, by the way. A lot of good resources there. And then we'll send that out to the public health units after.
yeah. And then anytime we kind of have some updates or something new, I'll try to remember to include you guys so that you can pass it along. And then my follow-up will be to just even ask, is it a possibility for our local public health units to get access, or if that's just not something that is feasible. But if you do have some of those nurses that are working in the schools, maybe you guys can double up at their computer when they're working through it. That might be a workaround.
Yep. And our block grant funding, the contracts that we have with AOD prevention and stuff like that with our public health units would support the promotion of this activity. It could be like presentations to stakeholders. It could be key stakeholder meetings. It could be providing information on this. We reimburse for all of those things. So if this is something that you want to take on, just know that we provide reimbursement for that.
And like I had said, if there's any way that I can help, if you have a group that you kind of want to share information about, just let me know. And I would be glad to assist in that.
Yeah, I think I kind
Great.
of connected a couple people already with you, Kayla, and kind of set up some meetings where you can do another presentation or just talk about it, answer questions. So yeah, that's definitely a good option.
Do my best car salesman spiel.
Oh, just so you guys know, Kelly, you don't know this. home tests for the COVID got extended for another 90 days. CDC.
Oh, is somebody not muted? I thought they were talking to you, Callie.
Oh, I thought so too. I was like, oh.
I thought I heard your name in there, but all right. Well, are there any other questions for Kayla, you guys, or about the program?
If you think of any, reach out. I believe, Callie, you sent out my email in that email that you originally sent.
Yes.
But yeah, feel free, reach out if there's something where I can't remember what you said about this or how do I get this again, just let me know, send me an email. Happy to help in any way. Really appreciate you guys helping us promote this in the schools that you're working with. We just find it so valuable and are really thankful for you.
Yeah, it's a great tool, and I'm really, really glad we're able to tie it in to our block grant and do some reimbursements for you guys on this, because it does tie directly into, you know, some of those topics, some of those issues. So it's a really good resource. Well, thank you, Kayla. I appreciate you presenting, and thank you everybody for attending. As always, let us know if you have any questions. I will send out a recording of this as soon as we get it uploaded. For those of you that were asking about the recording from our last quarterly presentation, I'm working on getting that out to you guys too as well. I know it's taking me a little bit, but I'm learning how to upload things to YouTube. So
You're light years ahead of me.
But all right, everybody, we'll give you some time back, and I hope you guys have a good rest of your afternoon and your Thursday.
Thank you.
Thank you, everyone.
Bye, guys.